Thank you. Good afternoon, everyone. Welcome to the Service and Serenity presentation, where we'll have a chance to explore the mental health benefits of community service, specifically through the nonprofit organization Swear to Care. So to start, I'd like you all to meet my friend Alex. Alex was a bright young high school student who struggled with anxiety and a sense of isolation. Despite having friends and family, he often felt disconnected and alone. One day, his school announced a volunteer event with a nonprofit where students would work on creative goods for other youth in the community. Feeling hesitant, but Alex did decide to give it a try. So at the event, Alex was surrounded by other students that were all focused on creating something super special for kids who needed a boost of hope. As he worked, something incredible happened. Conversations with fellow volunteers started to flow naturally, and for the first time in a long time, Alex felt connected. He realized that the act of giving, even in such a small way, brought immense joy and satisfaction. The smiles and laughter shared with other volunteers created a sense of community he hadn't experienced before. And by the end of the event, Alex felt lighter, happier, and more connected to the world around him. This is just one example of how community service can profoundly impact mental health. And this is, in fact, part of our story. My name is Soha Jashwant. I'm the founder of the Texas-based youth mental health awareness campaign and organization called Swear to Care. And today I'll be delving into how volunteering, particularly through organizations like Swear to Care, not only helps those in need, but also brings about remarkable benefits for the volunteers themselves. So, before getting too deep into the nitty-gritty, let me give you a better introduction of who I am and what our team at Swear to Care actually does. As I mentioned earlier, my name is Soha, and I'm currently a student at the University of Texas at Austin, where I study health and society. Welcome. And for the past few years, I've been investigating and working in the area of youth mental health, becoming increasingly invested and passionate as time has passed. Throughout my journey, I've had the opportunity to work with various marginalized youth communities in order to better understand their unique needs and think up initiatives to most effectively serve these needs. Swear to Care was born shortly after the height of the COVID pandemic had passed, and the impact on youth mental health was becoming more and more apparent. Our founding idea was simple: hold community members accountable for providing support to the youth community by having them swear to care for youth mental health, hence the name. As the campaign grew, we began adopting more impactful initiatives, and now Swear to Care's team and volunteer groups are dedicated to ending youth loneliness and restoring human connection through tangible impact on our community. This is done via hands-on service initiatives, by providing creative platforms for youth to express their mental health experiences, and by spearheading legislative action in order to make systematic changes for the betterment of youth mental health across the nation for years to come. So this component of loneliness and connection is the primary one that we work on. And to illustrate why, I'd like to present a few numbers for you all. An astounding 73%, nearly 3/4 of the Gen Z populace, have attested to feeling consistently lonely. What might this tangibly mean, though, you might be wondering? To better paint the picture of urgency on this matter, it's been found that an entire 32% of people that experience isolation tend to be at a greater risk of an early death. So having recognized this issue, the brainstorming on our team began, and the idea of community service came to light. An action to both combat loneliness as well as benefit the community in ways that it uniquely needed. One Voluntas review from May of 2023 explored this very concept: the societal, mental, and physical benefits of engaging in community service. According to the article, benefits were found in all three of these aspects, with reduced mortality and increased functioning being the most significant. Reflection and altruistic motivation were among the factors that increased the benefits even more. Despite technological advancements allowing for rapid globalization, as we all know, the reality is that we are more disconnected from one another now than ever before. So to create an initiative that brings youth together one of our favorite initiatives, Wristful Thinking, was born. A luxury bracelet in today's world costs around $400 to $4,000. Wristful thinking, as the name might suggest, facilitates youth volunteers in order to make bracelets with motivational messages embedded into them for other youth in need of uplifting, such as those in hospitals or temporary shelters. And these bracelets, they're priceless. In one run of this initiative, our volunteers made over 150 bracelets and creative handwritten cards. Most importantly, we received amazing feedback from both the volunteers and the recipients in their experiences surrounding the making of the bracelets or even receiving them, respectively speaking. Our goal at S2C is to foster community through authenticity and connection, and this initiative just serves as one example as to how we concretely go about doing so. So here is a quick list of my sources for the statistics that I shared earlier. And finally, I'd like to thank you guys for your time and the opportunity to share our work with you all. If you're interested in any of our other initiatives, please feel free to check our website, which I have listed on the screen, and or contact us via our email. I've also included my personal email in case you need it, so feel free to reach out. Thank you all once again.